Welcome to My Weight Live, everyone. We have a very special show for you tonight. We're going to talk with weight management expert Dr. Saima Khan about chronic pain, how to manage it, and how weight loss can help. It's going to be a fantastic show. Before we get started, though, tell me in the comments where you're watching from and if it's your first time joining us. Dr. Khan, thank you so much for being here with us tonight.
Thank you, Anstey. It's a great pleasure.
So we are talking tonight about the connection between obesity or excess weight and chronic pain. So let's start by defining the term chronic pain. When you use that term, what do you mean?
So Anstey, chronic is something that lasts longer. So, people use this word like acute or chronic. So acute is something that does not last more than 3 months. And chronic is something that lasts or linger on more than 3 months. And some experts also say that it can linger on more than 6 months. But most of the people most experts would say that anything that lingers on more than 6 months, it's chronic.
What's the connection between chronic pain and obesity? Are people with obesity more at risk for chronic pain? And if so, why?
Previously, we used to, think about like there's an indirect connection, but a lot of research supports this idea that people who suffers from obesity, they're at risk of developing into chronic pain, and vice versa. People who have chronic pain, they have more chances or more risk to gain weight. In either way, both influences it. So they have a very direct relationship with each other. So if I give you an example, people who suffers from weight issues, they have more tendency of developing back pain or knee pain, right? And people who have chronic pain, they would have more chance of developing into more weight just because of the mobility issues, stress hormones issues, and things like that. So they are very much interconnected.
So what I hear you saying is if we have obesity, we're more at risk for chronic pain, and that experiencing chronic pain makes us more at risk for obesity. That sounds like kind of a vicious cycle. What can we do about it?
It's tough. It's very difficult because, and that's why previously, like 7-8 years ago, we didn't had anything to offer to our patient except to tell them, eat less and move more, and kind of doing a lot of like blame talk and blaming it on patients. But now I think we are so blessed that we have so many things under our tool belt that we can offer our patients where it can break the cycle. But the first message that I want to make sure that everyone understands that we are dealing with something that is chronic, right? So chronic diseases are those diseases where there's no cure of a root cause. Like Ansi, for example, if you get a strep throat, I give you an antibiotic. So I do, treat the root cause. But when it comes to chronic pain or chronic obesity, we're actually not dealing with the root cause here. So anytime we are offering something, we are just doing a plaster work. We're just managing, right? So that's why it becomes so hard. So I think the first step is to make sure that whatever is working for you, keep doing it. Because if you stop it, then what will happen? It'll come back.
So I think a lot of people with obesity have been told by their doctor, well, if you're experiencing chronic pain, it's your fault. You just need to lose weight. If someone's hearing that from their doctor, what do you want them to know?
Ansley, I was one of them, to be honest. I mean, I have to apologize to all my patients. That was our attitude because we were trained in that way. So as you know, that I do focus into chronic intervention pain. And the reason that I came into obesity medicine is that because I was saying to my patient, hey, lose weight. You want your back pain to be better. You want your knee pain to be better. You want your heel pain to be better. Lose weight. But it was so hard for them to lose weight. And when I'm telling them, I was helping them for pain, but I was not motivating them. So that's why, I get really interested into it. And I think now we have so much better tools to offer to our patients that we can help them. So it's not only just moving less or, moving more or eating less. We can now offer medical treatment. So my biggest message to all my pain patients and obese patients, there is help available. And if your past experience with your physicians is not good, please forgive them, move on, because they don't know it, because it is something new.
So the field is changing, and it's having the conversation now, you'll have a different result than perhaps you've had in the past.
Exactly. And see, I would say past 7 years, we know so much about weight, like a research-based scientific, that I personally think that we have so much to offer to our patient, more than just saying that, here's a diet plan or go join a gym.
Oh, that's fantastic. All right, we're going to talk a lot more about that, but first we're going to take a break to do our trivia question. If you answer tonight's question, folks, you will get our 4 best tips for getting better sleep. Sleep can be challenging. Here are some practical tips on how to make getting a good night's sleep a little easier. You'll get them for free if you answer tonight's trivia question, which is, true or false, making your bed every morning can increase productivity? Can making your bed make you more productive? Put your best guess in the comments, and regardless of whether you're right or not, you will get those tips delivered to your Facebook Messenger inbox. And folks, we have a brand new free program called My Weight Weekly, where we send you a weekly text with a tip, article, or video focused on helping you reach your best weight. Get the support you need. Just text the word health to 844-966-1957 to sign up. Dr. Khan, we asked people in our Facebook group what questions they had for a specialist about chronic pain, and I have several of them here. Teresa asked, what's the process for pain management? For example, do you start with over-the-counter medication followed by prescription medication? And then what do you do if that doesn't work? How do you start working with your patients who are experiencing chronic pain?
So I think the first, we want to make sure that it's not acute versus chronic, and we should know what causes it. So as a physician, I would like to know whether am I dealing with a chronic primary pain where there's no source, or there's a chronic secondary phase. And of course, you start with what we call in our language multimodal treatment. So there's no one recipe, there's no one treatment. I just tell my patients, like, I am like a waiter to you. So you come to my restaurant and I am giving a menu of services, so I have medications, I have interventions, I have, my other colleagues, like allied health professional, massage, cryo, physio, and even small things like postures, vitamins, meditation, anything and everything that works for you, keep doing it. The key thing, Anstey, is that we are not dealing with the root cause, as I told you. So anything that works for you, keep doing it. So yes, there are, steps. So you start with medication. If that's not working, you go to the second and third, but you're not fixated on one. You want to try all the things, appetizers to desserts to entrees, and whatever works, and you can order it in whatever sequence you want.
So what I hear you saying is you're almost treatment agnostic. You're going to offer someone prescriptions. You're going to offer them, as you said, allied healthcare professionals, whether it's massage or cryotherapy. You're really open to exploring whatever may make a difference. That's what you're going to have your patients continue with if it's helping.
And see, it's not me. This is the current guideline. So chronic pain is something that you offer everything up front. You offer a multimodal treatment. And like some of our psychologists that I want to try this to see if it works for me, or if it don't, then I'm going to go to the next level. I tell my patients, poor you guys, you are suffering for it for a long time. Does it really matter what works, what doesn't? Try everything, whatever you have in your approach, and see what works, because right now what we are dealing with is the functionality issue. So the things that can improve your functions, even though your pain is still there, because it's chronic pain, it might go a little bit less, but functionality, sleep, mood, enjoyment in life, ambulation, if that works, do whatever it is. Even sitting straight works for you, keep doing it. This is a treatment to your condition.
So you said something earlier. You said if it's pain and we're not sure what the source is. And I'm curious to hear you talk a little bit more about that. So if I hurt my shoulder, for example, and I did it playing tennis, I know what the cause of that is, but that still might be chronic. Would you treat me differently than you would someone who perhaps they have back pain and they don't know where it came from?
Exactly. So again, the definition. So if you hurt your shoulder, we know the culprit, what's causing it. So ideally, any acute pain should be better by 3 months of time. But if it's developing into more than 6 months, that means either the source is not cured, or the source has changed into the chronic thing. So what does chronic mean? It changes the pathophysiology, how the nerve conduction is, and how the brain is perceiving the signals. So even though the source is there, but it has changed the way the brain is receiving the signals. So, Nancy, there is something we use a lot in our chronic pain world. This is a phenomena that is called a central sensitization. So, central sensitization is something that there's a part of the brain that captures all the pain signals, and this is the area that's called motor cortex. So when the signal goes to that cortex, every time pinging it, when somebody just rings the bell, and doesn't stop, that part of the brain gets really upset. Hey, you are disturbing me all the time, and that area is hurting. So what that part does, Ansley, it just makes like it's really get angry, and it sends a signal that I'm going to make you hurt everywhere. Poof, right? So everything around that shoulder would get sensitized. So not only that particular area will hurt, this all area will hurt, the whole arm will hurt because of the phenomena of central sensitization. And that's why I tell my patients, be aggressive in treating your acute pain so it does not get into the chronic pain stage.
So Henriette in our group asked, I would like to know how successful PRP is in the treatment of Achilles tendon/heel pain. I'm told by my endocrinologist I need to keep moving, but when each step hurts, it's not easy. That's really tough. What would you say to Henriette?
I think, Henry, that's a great question. That means you're doing your homework. I think there's two things. First, so heel pain can be due to Achilles tendon, or heel pain can be due to plantar fasciitis. So that is important to know what is the source of the heel pain, because we have a different, I would say, research on it. So PRP does give significant good results for heel pain due to plantar fasciitis, but I don't think so we have enough evidence with the heel pain due to Achilles tendon, right? But again, if it works for you, who cares about the research, right? So, but I think if you can afford it, try it out, because we know how PRP works and how it helps, building up the tendons. But as such research with Achilles tendons, we don't have much good evidence for that.
So Andrea says, I would like to know how often stress or anxiety is found to be the cause of chronic long-term pain. Great question from Andrea.
Andrea, thank you for asking. So in our pain world, we call it a triad. So triad means that you have chronic pain, mood problem, anxiety and depression, and sleep. And now in the middle, you put obesity. So they are interrelated, and it's not that it's unidirection. It can be bidirectional. Anything can tick off anything. So I would say that they are very much directly and indirectly related with each other. Anxiety can provoke pain. Pain can provoke anxiety. It's a vicious cycle, unfortunately. And believe me, all these four conditions that I mentioned, they are chronic.
So does seeking help, either prescription medication for mood disorders or, talk therapy, CBT, do you recommend those as well as part of someone's chronic pain treatment?
Definitely. So in multimodal treatment, the two things that I tell my patients, and I do work with their sleep, and I also work with their pain and with their mood. There's a lot of chronic based, mindful based meditation for chronic based. There's a lot of workshops that your local municipality or other peoples can offer you. The main thing with any chronic disease, NC, is acceptance and acknowledgement. The more you're accepting to a condition, the more help you can seek. And that is where the key thing lies, asking for help. Because, we don't want to disturb our loved ones. We don't want to go for help. Plus, we don't know if the help exists. And believe me, my dear, help is there.
That is really good news for our audience to hear. So if you're experiencing chronic pain, there are lots of resources out there that can really make a big difference. Speaking of those resources, Peggy asks, how to help the pain without so many drugs. Tell us what the options are for treating pain without necessarily relying exclusively on medication.
Great question, Peggy. And that's what we really don't want to push in chronic pain patients is medication. So again, you have lots of things in your menu. So we call it like non-med approach or non-pharmacological approach. I think the first thing is the first message to all my pain patients is that whatever your weight is, just maintain your weight. This is the key thing. So thinking about weight loss, I think it's an unrealistic goal. So whatever the life stage you are at and you develop a chronic pain, see what your weight is. And so weight maintenance is the key thing because it will not aggravate subsequent cycle. The second thing is any small thing that helps. Making sure that you are nutritionally equipped, your vitamin D, B12, your thyroid. Are you taking enough supplements? Are you nutritionally deficient, or are your levels are optimal? So this is something you want to discuss with your doctor. The other most important thing, because vitamin D deficiency and C is one of the culprit for chronic pain, and people who just get that treatment. And I just want to clarify that I am talking about treatment. So it's not the over-the-counter doses I'm talking about. So you get your vitamin D checked, you see if you're deficient, you get a treatment prescription and make sure your vitamin D level is adequate, and then you maintain through the over-the-counter supplements. So this is the key. People who would get numbness and tingling, B12, B6 deficiency as a bit, making sure that's adequate. We know that uncontrolled thyroid disease also influences it. So making sure that aspect is correct. And the key thing for chronic pain is making sure that your core abdominal muscles and your back muscles are strong. And you don't have to invest a lot of money into it. People will say, Dr. Khan, how many sessions I should have for physio? I said, you don't need to put any phys in. You just go learn one session and keep doing it, right? Because maintenance is the key.
So doing those exercises you learn from the physio on a consistent basis is way more important than having 20 sessions with the physio.
Exactly. So NC, you tell me, if somebody works on biceps, how long does it take for a bicep to build? 6 weeks, right? But how much time do you have to invest into maintenance? If
Forever.
You don't maintain it, what will happen? Exactly. So when you build an abdominal muscle, what do you need to do? Just leave it?
You got to maintain it.
Exactly. So small goals, but consistency is the key.
In case you're just joining us, folks, we're here with physician Dr. Saima Khan, getting her suggestions for reaching a healthier weight and managing chronic pain. And we're sharing with you our 4 best tips for getting better sleep if you answer tonight's trivia question, which is, true or false, making your bed every morning can increase productivity? Is that true or false? Can making your bed every morning make you more productive? Put your best guess in the comments and you will get those tips delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find tonight's show helpful, Dr. Khan is sharing such great information, please tag them in the comments so they can tune in with us. Dr. Khan, let's talk a little bit about weight loss and how it can help with chronic pain.
Ansley, I think previously we used to think that it's easy, but it's not. But any little help can help. So it's just, for example, we know that when a person gains weight, there's always a mechanical stress to the joints, or the weight or the pain itself causes the. Let's talk about the knee joint, for example. So the research has shown that if you are excess 1 pound, the knee will think that you are carrying by 4, multiply by 4 weight, right? So right knee will think I'm carrying 2 pounds extra. The left knee will think I'm carrying 2 pounds extra. So even if a person loses 5 pounds, that means 20 pounds, so 10. So the knee will thank you that, that my weight is less. So even small changes can help. Even sitting straight and making your abdominal muscles tight, your spine will thank you because a normal curvature comes back, right? Heel pain. And see, one of the new research that we got, we used to think that the weight just impacts the joints, right? Of course, it makes sense. There's a mechanical stress. We know that even the headaches will get better with some weight loss, like chronic migraines. And you would say, how come? Is my my adipose tissue is affecting my head? But we know that something other than the mechanical stress is something that is common for both chronic obesity and chronic pain. It's a state of low pro-inflammatory markers. So there is both of them. The research says that these are the conditions where there is a chronic low-grade inflammation. So when you lose weight, we know that migraine again is a process of inflammation. So even with any headaches, chronic migraine, it helps. That in fibromyalgia, weight loss would help.
Wow. So even losing a small amount of weight can make a big difference. I think when we talk about weight loss, though, people immediately think of like eating less and moving more, and I just need to have more willpower. But for many people, diet and exercise alone isn't enough to lose weight and keep it off. Talk about how the body and the brain works when it comes to weight loss and weight regain.
So there is something called as weight loss, and there is something called as weight maintenance. So the current guidelines and the current research is that we want to promote weight maintenance. Because, and see, we know that now it's a proven fact that the adult weight is determined by our genes, right? So whatever the adult weight around 24, 25 years of age, so our genes as your eye color and your hair colors is determined by our genes, our adult weight is determined by our gene, and it is controlled by our one of the brain organ, which is hypothalamus. So once it is determined, your body tends to determine it. So what if it would be nice and see you and me when we are 24, 25, and whatever is adult weight is, we maintain this weight throughout our life. So unfortunately, if you get into divorces, sleep problem, new learn, our weight is increased 5-6 pounds, and if you bring it back to whatever the weight was, how nice it would be, right? So think about weight maintenance, folks, before you think about weight loss, because if your scale is already not stable, weight loss might not be a realistic goal. So just maintaining your scale and then think about weight loss would work.
So, going beyond eating less and moving more, what are the other treatments that can be explored for kind of sustained weight loss and kind of that maintenance phase as well?
What I was taught in med school is all about diet and exercise. That was it. Now we know these two things are only 20% of the reason of gain weight. 80% is not in our hands. But now we know more about this 80%, so we can offer more. So this 80% is your genes, your genetics, your family makeup. And that determines something what we call as the appetite system. So humans have a very unique, very established appetite system, which is controlled by a set of hormones, just like a blood pressure or a pulse or body temperature is controlled. Same concept. The weight is determined by our genes, so whatever the genes you got, and the body tries to maintain that weight. And when these maintenance hormones, so when I'm talking about hormones, and see, I'm not talking about the reproductive hormones, I am talking about weight hormones. So in our body there are two sets of weight hormones. The one that helps maintains our metabolism. The ones that we eat does not make us hungry, and the other bad hormone is the one that causes hunger and slows down the metabolism. So this sets of hormone, this maintains our weight, and the things that are in our lives that causes the imbalance. So imbalance can be caused by our genes, but it can be caused by by certain factor like sleep, stress, medication. So when this axis is disturbed, this is where the weight gain happens, and diet and exercise would not help. This is a hormonal problem.
So, Dr. Khan, you're a physician who works every day with patients to help them manage chronic pain and to help them reach a healthier weight. Why can working with a physician be so helpful for many people who haven't been successful on their own?
I'm so happy that people are really looking into that, because previously there was no help. So the reason that you really want to go and seek help, just like diabetes, would you manage your diabetes by yourself? I mean, would you manage a depression or blood pressure, cholesterol, or heart disease by yourself? So, my dear viewers, you need to think, and not you, we all need to think that the weight or the pain, these are invisible diseases. I mean, and this is a problem with invisible diseases, that they're not shown in CT, they're not shown on blood pressure, but honestly, we believe you. It exists, and now the treatment is there. So just the way we treat diabetes or heart condition, that you need regular follow-up visits, there are medications, and along with that, there's a lifestyle. Same thing with these invisible diseases, that there is medication, there is surgery, there is lifestyle, and all of this will give you the best management possible.
Oh, great answer. Dr. Khan, thank you so much for being here with us tonight. This has been such a wonderful conversation.
Thank you, Nancy.
And a big thank you to everyone watching at home. Before we go, here's the answer to tonight's trivia question. True or false, making your bed every morning can make you more productive? According to productivity expert Charles Duhigg, that is true. If you didn't get to answer trivia, but you'd still like those tips for better sleep, leave a comment for us and tell us what you thought of tonight's show. My Weight Live will be back with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.